getting severely sick and needing medical attention. Our hospitals continue to be overwhelmed by COVID-19 and other patients, and this can limit the resources that are available to folks needing medical care. You may have seen the national headlines that last week, a resident of another southern state, Alabama, died after he couldn't find a hospital within 3 states that had an ICU bed available to treat his heart problems. We owe it to ourselves, our friends, our family, our community, our tireless doctors and nurses to stay healthy and stay out of the hospital. We can do that by getting flu shots. The quadrivalent flu vaccine that's currently available this year protects against the 4 most common different flu viruses that are expected to circulate this flu season. Flu vaccines are safe, effective, and they do not cause the flu. Many pharmacies, hospitals, doctors' offices around the state are already offering the flu shot. Please contact a location near you to see if flu shots are available to you yet. We're also continuing to stay connected with our federal partners and monitor information about Pfizer's announcement earlier this week that its COVID vaccine is safe and effective for children ages 5 to 11. The vaccine has not yet been approved for children ages 5 and 11, but it's promising to hear the report from the vaccine manufacturer. You may have seen headlines that the vaccine is expected to be authorized for children those ages by Halloween. Well, let me give you a brief overview of the steps that are needed to occur in the federal authorization process. So first, Pfizer needs to gather their data on safety and efficacy into an application format. They then present that to the Food and Drug Administration, the FDA. Pfizer has publicly announced that they hope to submit that data by the end of this month. If the FDA spends about the same amount of time reviewing the data for that age group as they did for the 12 through 15-year-olds, the shots could be available by Halloween, but it's also, of course, possible that it might take longer to review that data. We're hopeful that the vaccine will be authorized for use end of October or maybe early November. We do continue to encourage everyone who is 12 years and older to get fully vaccinated, and for everyone to continue to wear masks while in public. These continue to be the greatest tools that we have for keeping each other safe and ending this ongoing pandemic. Thank you.
Thank you very much, Dr. Kelly. I'll go ahead and start with some of the pre-submitted questions that we received for this week. So Dr. Kelly, the first question we have is, do you expect another surge of cases this November, December, and January? And how severe do you think it could be?
Well, of course, it's difficult to say, but until we have more people vaccinated, South Carolina is still at high risk of continued high numbers of new cases. We urge everyone who's still unvaccinated to get their COVID-19 vaccine as soon as possible before the holidays. Even if you had COVID infection in the past, you can strengthen your immunity with vaccine. There are studies in the US and those studies out of Israel that have shown that if you had prior COVID, you can cut your chances of reinfection in half with vaccination.
Thank you, Dr. Kelly. Next question is, as vaccination rates rise, would we expect to see the percentage of cases involving vaccinated people also rise? And should people take this as proof that the vaccines do or do not work?
That's a very insightful question. Let me first state just from the very start that breakthrough infections among people who have been vaccinated are rare. About 0.4% of the over 2 million people who have been fully vaccinated in South Carolina have had a breakthrough infection. So yes, as our vaccination rates rise, the percentage of cases that are vaccinated will also rise. But we expect to see a substantial drop in the number of people who need to be hospitalized, number of people having severe disease, and the drop in the number of people dying of COVID-19 as more people are vaccinated.
Thank you, Dr. Kelly. After the president announced a mandate that all employers with more than 100 workers must require workers to be vaccinated or to be tested for the virus weekly, what is Dhec's plan for employees?
We're awaiting additional federal guidance to help us understand exactly how the vaccination requirement will be managed at the state and individual employer level. There are currently 1,082 providers in South Carolina able to provide COVID-19 vaccine, and there is plentiful vaccine supply to match any increase in demand for a potential vaccine requirement. There does exist the potential for significantly increased testing volume as a result of this type of requirement, and DHEC is working to develop plans that are going to meet that demand with available resources and testing vendors.
Thank you. Our next question is, what is your reaction to the FDA panel not recommending booster shots for all people, but is recommending for 65 and older healthcare workers and others with high occupational risk of exposure? Is it a good first step?
So, point of clarification, the panel that met last Friday was the Vaccines and Related Biological Products Advisory Committee, not the FDA itself. They are a committee that reports to the FDA. The FDA has taken their recommendations, but they have not yet made a determination regarding boosters. They're in fact meeting today to examine that information, that data. I'm personally not surprised that the panel did not recommend boosters for all, as they noted that there's a lack of safety data on the extra doses. Pfizer presented really a small number of patients who had received booster doses in their studies, and the advisory committee also raised some doubts about the value of mass boosters. Do we really need boosters for everybody? Providing booster doses for people aged 65 and up and those with certain medical conditions does make sense, as these are the people who have an increased risk of severe COVID. Boosters for certain occupational groups also make sense because of their high risk of exposure. But at this time, we need to wait on boosters to hear what FDA does with their EUA, whether they amend the EUA, which groups they include. And we also need to wait on the Advisory Committee on Immunization Practices, ACIP. They are meeting today and tomorrow to make their recommendations.
Great, thank you, Dr. Kelly. The next question is, what percentage of DHEC employees are currently vaccinated? Oh, Dr. Kelly, I think you're on mute somehow, and I cannot unmute you. Can you unmute yourself?
Yes, I don't know. I must have touched the wrong thing. Sorry. DHEC regularly sends internal messages across the agency that provide updates on the pandemic and encourages vaccination among employees. However, DHEC isn't tracking the number of employees who are in fact vaccinated, and we're not asking our staff to disclose that information.
Thank you. The next question we received is, a lot of businesses and schools are investing in higher quality air filtration because of COVID. How helpful are these systems in preventing the spread of COVID-19?
The best approach to preventing COVID transmission is to implement multiple measures. Higher air quality filtration is a helpful measure for sure, but we cannot rely on that measure alone. Multiple mitigation strategies are needed. Vaccination for those aged 12 and up, wearing masks, maintain physical distance between people, testing, isolation for those infected, quarantine for close contacts, and increasing ventilation have to work together to prevent the spread of COVID-19.
Thank you, Dr. Kelly. And we are down to our last two questions. Some online believe the number of COVID deaths are being inflated. Is there any reason to believe there are fewer COVID deaths than health agencies are reporting? Do hospitals get more funding by reporting a death as a COVID-related death?
Let me take that second question first. So providers can get additional reimbursement through Medicare, as that was a component of the CARES Act that was passed by Congress and signed by the president, as a partial offset for all the extra costs that are incurred in taking care of a COVID patient. Think about all the additional costs for the types of PPE, personal protective equipment, that are used. Hospitals are paid higher Medicare rates for COVID patients and their treatment, but I am not aware of any evidence for fraudulent reporting. You know, it's important to remember that DHEC doesn't determine the cause of the death, and the hospital itself doesn't determine a cause of death. We are record keepers for death certificates as they're completed and filed by coroners or by medical physicians who certify, who determine whether an individual's cause of death was COVID related or not. So we compare the information about the death of a COVID patient that was initially reported to us to the information recorded on that individual's death certificate. And if we notice any discrepancies, we reach out to the coroner or medical certifier to point out the discrepancy in that information we have about the individual's death. So again, just to be clear, it's coroners and medical certifiers who determine a person's cause of death, and they use specific guidelines from CDC for how to determine that cause of death. We have no evidence for fraudulent reporting from hospitals.
Thank you, Dr. Kelly. And the last submitted question for today is, what is your reaction to the news from Pfizer regarding the outcome of the trial of vaccinating 5 through 11-year-olds? I know it must still go through the process for EUA, but is this at least a light at the end of the tunnel?
Well, Dhec is aware of Pfizer's announcement that the phase 2 of 3 of its COVID-19 vaccine trial for ages 5 through 11 has shown the vaccine to be safe and effective in this age group. This is very encouraging as we continue our efforts to get as many people vaccinated as possible. But that said, Dhec has still not seen that clinical trial data, and so we cannot comment further since they are very early on in the approval or authorization process. Pfizer still, as I mentioned before, needs to apply for an EUA, the emergency use authorization for the vaccine for this age group from the FDA. And then once the FDA issues the EUA, that's when CDC's Advisory Committee on Immunization Practices, ACIP, provides clinical guidelines for use in these younger age groups. All of that needs to happen before those younger age groups begin receiving vaccination. Dhec supports these and other efforts to offer safe, effective COVID-19 vaccinations. We look forward to continued scientific review of vaccine for younger school-age children. But in the meantime, again, we strongly encourage everyone 12 and up to get vaccinated as soon as possible. That will help protect those under age 12 who cannot be vaccinated as yet. COVID-19 vaccines have some of the highest efficacy rates we've ever seen among vaccines, and they are saving lives daily. Vaccines can and will help us end this pandemic.
Thank you, Dr. Kelly. So that was the last of our pre-submitted questions. For those of you on the call, if you do have a question, go ahead and raise your little Teams hand to see we have several, or you can reach out to us in the chat box. I'll try to monitor that as well. So I'll just go down the list in order. Tina Terry, if you can unmute yourself and ask Dr. Kelly your question, and if we can all just ask one question at a time, please.
Dr. Kelly, thank you so much for talking to us this afternoon. I wanted to ask you a question about monoclonal antibodies. I know last week Dhec had said that the federal shortage would be impacting the supply that comes to the state of South Carolina. Have you talked to federal officials about when more doses will be made available? And can you talk a little bit at length about how this could impact our state and specifically rural South Carolina?
So certainly Dhec has been in constant contact with the federal officials about monoclonal antibodies and other interventions for COVID-19 care, vaccination supplies, and other matters. So currently, it is true that we have received a lesser supply of monoclonal antibodies than the demand at this time. However, I know that there are ongoing efforts to increase the supplies of monoclonal antibodies, not just to South Carolina, but nationwide. And so those are ongoing efforts. I'm not sure if I'm answering your question. It is a concern. We're in touch with the clinicians who are administering the vaccines, as well as in touch with the federal government regarding future supplies. We are optimistic that there will be some increase in future supplies, cautiously optimistic.
Thank you, Dr. Kelly. Dana Lynn, do you have a question for Dr. Kelly today?
Yeah, real quick. At North Augusta City Council meeting on Monday, the mayor took the steps necessary because they were not in place, took the steps necessary for boards and commissions like planning commission, that kind of thing, and even city council to hold virtual meetings if it became necessary or if the board members felt it was necessary because, well, Delta hates everybody. You think that's a reasonable thing to have in place at all times?
I think we have to always think ahead of the Delta variant, always think ahead in public health. It's almost like hurricane preparedness, that you hope it won't come to this, but you need to have a plan. So I think it is very appropriate for them to think about how to make a plan, how to understand what their membership is concerned about, and how to address those concerns.
Thank you, Dr. Kelly. Emily, I believe you're next. Oh, wait, I skipped over Mary. I'm sorry. Mary Green, did you have a question for Dr. Kelly?
Yes. Hi, Dr. Kelly. Looking at the statewide data over the last 14 days, it looks like cases are decreasing, hospitalizations are still high, but starting to level off a bit, and deaths are now rising. Knowing that this has, of course, been the cycle of peaks over the course of the pandemic, does this indicate that this late summer / early fall peak might be starting to come down in South Carolina?
It might, but it might not. Unfortunately, I don't feel that we can be confident that we have turned the corner. I think that we still have a lot of challenges with our hospitals being filled with severely ill individuals, coming close to capacity in many cases, not all filled with COVID patients, but certainly it's having an impact on our healthcare system. So I am hopeful that this is a sign that we will have a continued downturn, but I'm nervous about people becoming too complacent. If we let down our mitigation measures, we let down our guard about masks, about the importance of getting vaccinated, of the importance of keeping our distance, especially in indoor settings, then we risk that surge going back up again.
Thank you, Dr. Kelly. And Emily, I believe you have a question for Dr. Kelly.
Hi, Dr. Kelly. Yes, I wanted to ask about the AARP is reporting that deaths in nursing homes has gone up in the past month in South Carolina. Can you speak to that at all?
It has, and that is just tragic. We have had an increase in the number of deaths in nursing homes, and we've also had an increase in number of cases among residents of nursing home and among staff in nursing homes. And there are multiple factors that feed into this, but part of it has to do with the lower levels of vaccination among some members of residents and staff in some of those nursing homes. Vaccination continues to be probably our strongest weapon. Let me restate that. Vaccination is certainly our strongest weapon against COVID-19 hospitalization and mortality. The uptick in nursing homes is related in large part to the lack of vaccination among everyone.
Thank you, Dr. Kelly. And Simon Williams, did you have a question?
Yes, hello, Dr. Kelly. Simon Williams with WPDE. I have a question on vaccine hesitancy. We're just seeing some confusion on why there's hesitancy. I'm wondering if you can share from your experience, from what you can tell, why there's so much hesitancy now when vaccines have generally been well received over previous years.
There are a lot of different aspects to vaccine hesitancy. So some individuals have heard the untrue rumor that vaccines can affect fertility. They do not. We've got studies with more than 35,000 women who were vaccinated either right before they got pregnant or during pregnancy, and there was no increase in miscarriage, no indication that vaccine decreases fertility. But that rumor is still out there, and it still worries some people. Some people are vaccine hesitant, not so much because they don't trust the vaccine or they fear the vaccine. They just don't feel it's a priority for them. Individuals who are young and healthy who feel, well, if I get COVID-19, I won't be terribly sick. It is true that young, healthy people are less likely to have severe illness, but I think they're not thinking of the rest of the community that they touch. If they get COVID-19, they might in turn unintentionally transmit the virus to a susceptible child under 12 who can't get vaccinated, or an older adult or an immunocompromised adult for whom the vaccine didn't take as well. They didn't have as robust an immune response. I do know there are also some folks who feel, I already had COVID, therefore I don't need the vaccine. It's not true that having had COVID-19 means that you're completely immune and you cannot get infected again. Certainly, prior infection offers some protection. We know, for example, people who have had COVID infection within the last 90 days, reinfection is rare. But we don't know after that 90 days when that immunity starts to drop off. And we do know that there is benefit to being vaccinated, even if you had prior COVID-19. You can more than half your risk of getting reinfected if you get vaccinated after your prior infection. Other reasons for COVID vaccine hesitancy run a full range. Many people are just suspicious of any sort of vaccine, and there'll always be some anti-vaxxers. I think the number of people who have expressed vaccine hesitancy is decreasing, though. We are slowly but surely seeing an increase in the number of people who are coming forward to be vaccinated.
Thanks, Dr. Kelly. And Mary, I see your hand is still up. Did you have another question for Dr. Kelly?
Well, I didn't, but now since I'm here, I'll ask Dr. Kelly. Going forward, knowing that certainly at this point a substantial portion of the population is either vaccinated or at this point has at least some temporary immunity, having been infected recently, unfortunately, does DHEC anticipate that future surges might not be as bad as what the state's experiencing right now?
As always, it's very difficult to predict what might happen, because the other possibility is that with so many people still unvaccinated, that leaves a large pool of people in which the virus can circulate and increase the chances of it mutating, and we get yet another variant. You know, this big surge that we had starting in July, part of that was people backing off on mitigation measures in a population that was largely unvaccinated, but it was undeniably true that the Delta variant, which spreads more easily, contributed to the surge. So while I am, as I said earlier, cautiously optimistic that we might start to see a decrease in number of cases, that does not mean that we're by no means certain that there will not be a surge in this fall and winter, as more people are indoors, as more people might travel and gather around the holidays. If another variant emerges, that might be another cause for a surge.
Thank you, Dr. Kelly. And Judy, do you have a question?
I do, Laura. Thank you. And thank you, Dr. Kelly. You mentioned earlier about DHEC being in kind of ramp up mode in anticipation of needing to offer more capacity for testing once we see the federal mandates kick in. Does that capacity for testing include any consideration to testing at schools, at any of the schools around the areas, to help reduce the number of quarantines that we're seeing?
Absolutely. I'm glad you asked that question. And in fact, DHEC has a number of rapid tests that are available for use in schools, not just use for diagnostic purposes. For example, if you have a sick child and the nurse wants to test them. No, I'm talking about routine screening testing programs where you just routinely test a certain percent, a certain proportion of students or teachers or both at a school to try and detect COVID-19 earlier when it may be asymptomatic, to try and prevent the spread of infection. DHEC has a program that is available to help support schools in this effort. We can supply the test kits, the supplies, but there's also funding to support efforts for schools that want to do this sort of screening testing so that the burden of testing doesn't all fall on the school nurse or on school personnel, that there are different ways that they can approach this, including hiring a vendor, a company that could come in and do that routine testing. This is a decision that is made at the individual school or school district level, but DHEC is available to help back that screening testing program up.
Thank you, Dr. Kelly. And if there's no other questions for the day, we will go ahead and conclude just a minute or two early. We appreciate each of you being on this call and continuing to help get out important information. And we especially appreciate Dr. Kelly and all of our doctors who make the time for these weekly briefings. So thank you all very much, and we'll see you all again next Wednesday. Thank you.
Bye.
Thanks, everyone.